Now I give the floor to Professor Bjørn Stensaker, Vice Rector of Education at the University of Oslo, a leading academic institution who initiated cooperation with Palestinian universities and other Palestinian institutions 30 years ago, exactly 30 years ago. The floor is yours.
Thank you, and thank you for the warm welcome. Welcome to this year's Per Fugelli Lecture. As the Vice Rector of the University of Oslo, it is my pleasure to welcome you all to this event, which provide, unfortunately, a much-needed context and a space for reflection related to the catastrophic events unfolding in Gaza at this very moment. The University of Oslo has always had an identity as an international-oriented university. But in current strategy, the global perspective, the responsibility and the academic focus of our university plays a more fundamental role than in the past. We do believe that universities have an important role in contributing to a better world for all. We aim to actively contribute to the UN 2030 agenda and the accompanying sustainable development goals. Medicine and higher education plays an important role in all of these goals. Following the horrible terrorist attacks on Israel on October 7th, we have witnessed month after month of civilian killing and destruction in Gaza by the Israeli state at an unprecedented level. What is especially worrying is the way that these attacks has destroyed universities and the health system. Protecting and ensuring access to higher education during conflict is enshrined in international humanitarian law. There is a reason for this. The destruction of educational infrastructure represent one of the greatest development setbacks for countries affected by conflict and hinders the ability of societies to recover after the war. During this conflict, Israel has destroyed buildings and infrastructure at all 12 universities in the Gaza Strip, and many academics have also been killed. As universities have an important role in the reconstruction of society after the war and the establishment of a lasting peace, this destruction have long-lasting effects. International humanitarian law also states that all parties to conflict must fully respect and protect medical infrastructure, hospitals, ambulances, personnel. As we all know by now, Gaza's health system has been dismantled. More than 400 healthcare personnel has been killed. Also here we could see ramifications far beyond what is happening today, and with disturbing consequences for those of you who are medical students wanting to engage in future humanitarian missions. If the international society tolerate these violations that we see currently, how can the safety and the future of doctors be defended in humanitarian operations in the years to come? As mentioned in the introduction, the University of Oslo has collaborated with Palestinian universities for decades. A key event in this collaboration took place in 1994 when former rector Lucy Smith headed a delegation with members from several universities at University of Oslo to universities in the West Bank and Gaza Strip. The Faculty of Medicine has continued its research collaboration with Birzeit University ever since, and the faculty has later been a key partner in the Lancet Palestinian Health Alliance, with annual conferences taking place focusing on various health issues among Palestinians in and outside the occupied Palestinian territory. This collaboration has led to tangible results. 11 Palestinian PhD students have been trained, 9 master students have graduated, and more than 250 Palestinian and Norwegian researchers have been involved in the partnership. The cooperation has also resulted in more than 50 scientific articles and more than 30 reports written by Norwegian medical exchange students. Unfortunately, the research collaboration has also shown that Palestinian academics are treated differently by the Israeli authorities than their Israeli counterparts. This affects Palestinian academics' freedom of traveling, their opportunity to take part in conferences abroad, but also inside occupied territory. Several of these studies also show that health has been severely impacted by years of occupation. Scholars at Risk, the global rescue scheme for academics and students, play a key role in supporting scholars finding themselves in these threatening and dangerous situations, both via international solidarity campaigns, but not least by helping to facilitate temporary posts abroad to give vulnerable scholars a safer place. The University of Oslo will be receiving, hopefully, if we can get them out, 3 scholars at risk from Gaza this spring. One of them a professor of medicine, which will be hosted by the Faculty of Medicine. While scholars at risk indeed need attention, I also want to take this opportunity to express a message of solidarity and support to all those suffering from the horrors that we are witnessing at the moment. This message of solidarity and support is not least directed to students and faculty here at University of Oslo, directly and indirectly affected by the war. A few years ago, the Secretary General of the United Nations stated the following, and I quote, "In an interconnected world, solidarity is self-interest. If we fail to grasp that fact, everyone loses." And this brings me back to the person that we are honoring today, Professor Per Fugelli. Back in 1993, he wrote a paper entitled "In Search of a Global Social Medicine." This lecture series is built on arguments found in this paper, arguments for solidarity as a basis for global health work. Starting in his academic career in general practice, Per Fugelli received a professorship in social medicine at University of Oslo in 1991. And as a professor of social medicine, he ventured into a career as a public intellectual, speaking up against social injustice, both within medicine and in society. He quickly gained a position in the Norwegian public that few academics enjoy. People in marginalised positions, substance abusers, undocumented migrants, or just poor people, found in him a unique and engaged spokesperson. I'm confident that Per Fugelli would have been very pleased in the selection of this year's speaker, Dr. Ghassan Abu-Sittah, a passionate defender in social medicine. I'm equally pleased to welcome you all to this year's Per Fugelli Lecture.
Oh, fantastic to see all of you. I'm Anne Kveimli. I'm member of the organizing committee. And I'm so pleased to be able to introduce Dr. Ghassan Abu-Sittah, and I'm pronouncing it horribly, sorry, as our 2024 Per Fugelli Lecturer. Ghassan received his medical education at the University of Glasgow and completed his residency training in London before he, in 2011, became the head of the division of plastic and reconstructive aesthetic surgery at the American University of Beirut, who, as you might not know, all of you, is known as the Middle East's foremost medical center. There, he played a crucial role because what does a plastic surgeon do at the trauma center? Well, he creates and plays a crucial role in the center's pediatric war injuries program and war injuries multidisciplinary clinic. He has also worked as a war surgeon in Yemen, in Iraq, in Syria, in South Lebanon, and during the 5 wars in the Gaza Strip. He has published widely on all aspects of facial surgery and the treatment of conflict-related injuries. He has also written a textbook. He holds honorary positions at Imperial College and King's College and serves as the clinical lead for the Operational Trauma Initiative at the WHO, World Health Organization. But Ghassan is more than a surgeon. He is also always thinking beyond the operating room, which is why I am so pleased, because many of you are medical students. There's also a lot of else of you, and you're welcome. But for the medical students, I want you to know that it's possible to be a plastic surgeon and think beyond the operating room. He not only, when he is in the surgical operating theater, he not only tries to treat the problem he has at hand, but also goes on to find out why it occurred, what kind of social and economic factors led to it. He teaches and he does activism. And in this way, he is a true practitioner of social medicine in Per Fugelli's spirit. For example, when he, as a war surgeon, saw how there was a pressing need to systematize and teach to others experiential knowledge acquired during conflicts by war surgeons who mostly returned to their countries of origin after the war had ended and doing their normal work. So in order to create, therefore he created a center where knowledge could be stored, published and transmitted, and co-funded and directed the conflict medicine program at the Global Health Institute at the American University of Beirut. Or when he, after having managed to enter the Gaza Strip on the 9th of October 2023, operating day and night, also understood that he had to bear witness to the world of what he was seeing. Continuously, during the Israeli bombardment and during all this overload of work, he also contributed critically and crucially to the news coverage in a period where the Western press did not believe the other things they were hearing from Gaza. There's so much more to say, and everybody who has heard him talk, and he has increased his audience a lot during these 7 months. We have been a lot of people who have been listening to him, knows that he is both a humanist and also a champion of social justice. And I know that Per Fugelli, Charlotte, would have been so pleased that he is here today. So welcome, Ghassan. Thank you for being here.
Thank you very much. Thank you, Anna, and thank you all for this invitation and this honor. Today's talk is really to try to understand what is happening, not just in Gaza, but to use our understanding of what's happening in the Gaza Strip as a way of understanding war, as this most brutal of genocidal wars is waged on a small plot of land, 360 kilometers square, with a ferocity that has never been seen before. It allows us to both stand in solidarity with the victims of this war, but also to see how other conflicts played out over larger periods and over bigger surface areas alter human life. So war kills through the destruction of the biological, the physical, and the social. And so far in this war, there have been 38,000 Palestinians killed and 70 more wounded. But it's not 38,000 that have been killed. There are 38,000 that have been killed, their bodies identified and brought to the morgue, and then a death certificate was released. There's assumed to be between 10 and 20,000 still buried under the rubble. And as a result of what are called in Gaza fire belts, which is the carpet bombing of whole neighborhoods, there is probably another 10 to 20,000 who have died and never been claimed as missing. Because the way Gaza is organized, extended families or hamulas or clans live in the same neighborhood. And so when you drop 9 to 10 2,000-pound bombs over a neighborhood, there's no one left to claim the dead. And the way this war functions, and the way all wars function, in two temporal speeds. There's the immediate, which is how people are being killed while the war is conducted. And then there's the permanent, i.e., the world that is created as a result of this war that continues to kill people. And so in Gaza, we've seen 29,000 bombs being dropped on 360 kilometers. We have seen infectious diseases on an epidemic level take hold of the population. The destruction of the health system, denying patients with chronic diseases the treatment that they need, and then for converting chronic manageable diseases like hypertension, heart disease, diabetes into emergencies that kill. We've seen the destruction of maternity and obstetric services, leading to an increase in maternal deaths and an increase in neonatal deaths. And we've seen the re-emergence of the tried and tested colonial weapon of starvation that we first saw the British use in Ireland, and then we saw in Africa, in Latin America, in India, used to great effect. But what we also saw, which started on the 17th of October, is the way the destruction of the health system has been central to the conduct of the war. On the 17th of October, a missile was fired at Al-Ahli Baptist Hospital, leading to the death of 480 Palestinian women, children, civilians who were seeking refuge. And soon after, the destruction of 3 pediatric hospitals in Nasr, Rantisi, Muhammad al-Durra. Then the shelling by tanks of Al-Quds Hospital, the one run by the Palestine Red Crescent Society. And then the surrounding of Shifa, and then rebombing of Shifa. And then the attack on the Indonesian hospital in the north. And then moving to the south, attacks on Al-Aqsa Hospital in Deir al-Balah, and then Nasser Hospital being occupied in Khan Yunis, and then Al-Amal Hospital being bombed. And I believe that it doesn't take great analytical skills to understand why this is happening. Israeli politicians, from Netanyahu's famous Amalek speech to human animals analogies by the head of the Israeli army, to every utterance by an Israeli politician or a military leader, has made clear that the aim of this genocidal war is to ethnically cleanse Gaza. And one of the ways you do that is by making Gaza uninhabitable. And so the destruction of the health system allows what we spoke of previously, which is this transition from the immediate to the permanent, acts as a catalyst for this transition from the immediate to the permanent. And during the immediate, it optimizes the killing through injury. And so very early on in the war, I would say by the middle of the second week, although Gaza's total bed capacity was 2,500, there were 6,500 wounded. And in Shifa, the bed capacity was 600, and we had reached that by the beginning of the first week. And so what happens as you reduce the capacity of the system, and we saw that every day, and it's something that we are all taught and trained in emergency medicine, the triage becomes more acute. Your decision to decide who goes to the operating room and who's left to die on a stretcher because you cannot help them becomes almost a daily, if not an hourly occurrence. As the hospitals were being destroyed, I found myself in Al-Ahl, back at a half-destroyed Ahli Baptist hospital. And there were two of us, myself and an orthopedic surgeon with 2 operating rooms. And we were the only hospital left functioning in the whole of Gaza City. And so with every air raid, we would have hundreds of wounded. And we would have to decide, those 2 operating rooms, who goes in, who's left on a stretcher to die, who's bandaged and put in the corner of the hospital. So when we start to dissect the number of the injured, around just over 70,000, of these 70,000, around 80% did not receive medical care. All they received was a quick cleanup and a bandage, and then being put somewhere in the corner of a hospital, sometimes on a stretcher, if they're lucky, most times on a mattress on the floor of a corridor. And so if this war ends, these 80% of the 70,000 will still require surgery. And these are complex injuries, a lot of them multi-system trauma, a lot of them compound injuries, as in there's loss of soft tissue, there's loss of bone. And from our previous experiences, and I saw Mads briefly somewhere when he walked in, previous experiences in the marches of return, it took on average 14 surgeries and 3 years to treat one conflict-related compound fracture of a long bone. So you can imagine how much this is going to take in terms of treatment. We know that half of these patients, and we knew very early on when we noticed that half of the wounded on the operating list were children. Half of these wounded are children. And we know from previous experiences in wars that children require constant surgical intervention as the body tries to grow, while the injured part, the scarred and fibrotic part, is unable to keep up with the body. And so a paper that was done by Mads and a group of collaborators looking at conflict-related amputations found that they require between 8 and 12 surgeries by the time they're adults. And so again, you look at the number, 30,000, 35,000, which is half of the 70, needing between 8 and 12 surgeries each over the next 10 to 15 years. So, what are the other killing machines that we are witnessing? Well, when you systematically, and by systematically I mean at every junction of the process, destroy the water and sewage treatment plants. So you destroy them at the pumping station, you destroy them at the sewage pipes, at the collection sites. You force over 1.5 million people to move from their homes to schools that had been designed to hold 1,000 students for half a day, and now hold between 10 and 15,000 internally displaced civilians. And with all of that in terms of access to toilets, in terms of access to clean water, to drinking water. And you do that to a population that is already immunosuppressed. So the 70,000 wounded are in the catabolic phase. These open, untreated wounds are hemorrhaging protein because they are, one, left untreated and unreconstructed. Two, have already, because of the delay in treatment, developed, if not a septic, infective process, a subclinical colonization. And you add the starvation and the malnutrition to the immunosuppression perfect storm, and you will end up with what we're seeing now, which is over 700,000 Palestinians with reporting some element of infectious diseases. So 8,000 cases of hepatitis A, respiratory infective diseases, diarrheal diseases, lice, scabies. But what you're also going to witness, and what one of the emerging and the irony of all ironies is it's emerging because Israeli soldiers wounded in Gaza are coming back to Israeli hospitals with it, is the emergence of antimicrobial resistance. Because, and I'll talk a bit about that, everything that's happening in Gaza is a driver for antimicrobial resistance. And so that is part of the kind of permanence of the ecology of war. Actually, it lies at the heart of the permanence. The alteration of the genetic makeup of the smallest unicellular organism from susceptibility to resistance to antibiotics happens in these wars. Maternal health, around 183 women are expected to give birth daily, but actually of all of the maternity services in Gaza, there is only one single hospital, small NGO hospital left in the southern part of Gaza. Early on, as the Israelis were approaching Shifa Hospital in November, the Israelis fired phosphorus bombs on the maternity building of Shifa Hospital and Al Hilo Hospital, which was another private maternity hospital. And so women are either now delivering in these overcrowded schools that have become centers for the internally displaced, or those requiring cesarean sections come in to this one hospital, they have their cesarean, they're given an hour, and then they leave because there needs to be someone else to come and occupy that bed. There's no access to pre- or postnatal care. And as a result of the malnutrition, the fact that there is no clean water, because the Israelis had, at the beginning of the war, targeted the 3 desalination plants the EU had built in Gaza to improve the quality of drinking water. These women have no access to what they need in terms of calories and in terms of clean drinking water. And so 50% are now anemic, and this increases the risk of preterm and low birth weights. It increases miscarriages, it increases stillbirths, it increases maternal deaths. And then what we know is that those children that are born underweight. They grow up to be adults that are much more susceptible to non-communicable diseases. There's more likely, due to poor obstetric care, an increased risk in brain damage. So all of these things are part of that transition from the immediate to the permanent. As the whole health system was dismantled, and with it the complete blockade that was announced on the 8th of October, medication for communicable diseases was stopped. And until now, the Israelis classify insulin pens as dual use and prevent access to insulin pens in Gaza. We know that people affected by humanitarian emergencies are at an increased risk of developing non-communicable diseases, even if they didn't have them, as a result of the stress, as a result of the malnutrition. We know the association now between type 1 diabetes and starvation in childhood, and the increased risk threefold of strokes and MIs following a humanitarian disaster. This manufactured famine that we see has sent acute malnutrition in under fives from 0.8% to 16.5%. And we know that acute malnutrition is a iceberg, and it's the tip of the iceberg. And chronic malnutrition is the rest of the iceberg that we don't see. And that chronic malnutrition affects cognitive capacity in these children, where studies on MRIs of brains of children with chronic malnutrition showed a smaller brain and smaller cognitive centers. We know that they're more likely to develop non-communicable diseases when they become adults at an earlier age that are much more severe. And so there's reports that all households are skipping meals and that adults are reducing their meals to give children. But despite that, due to the acute enforcement of the blockade, particularly in the north, where we saw massacres of people trying to access the flower convoys that the UN had sent, that malnutrition in the north is worse than the south, but also exists in the south. But also there was an intentional destruction of the agricultural areas in Gaza to make sure that Gaza cannot feed itself. And a similar process happened in the health system, where the UN had set up a project where they provided all of the hospitals with solar panels so that they would become more self-sufficient in terms of the energy needs and would not be so dependent on fuel. Well, one of the things the Israelis did very early on in the war is that they went around just targeting the solar panels. And the same in the agricultural areas. They target the agricultural areas and they target the farmers to ensure that not only is food not getting into Gaza, but that food can no longer be grown in Gaza. So that's the destruction of the biological. We now move to the destruction of the physical. There was an estimate by the UN that there is 23 million tons of rubble at the moment in Gaza from the destruction of urban environment. So we want to turn back to what we know from Iraq and from Syria, and what we know from the work that's being done on the relationship between antimicrobial resistance and conflict, is that the selenium in cement is one of the heavy metals that is causes mutations that induce antimicrobial resistance in certain bacteria. That copper in the piping also induces antimicrobial resistance. That the plastic in the wiring of these buildings that have been exploded by 2,000-pound bombs are carcinogenic and teratogenic. And so when we look at the rubble, we should not just see the destruction of what was, but actually a harbinger of what will be the result. Increase in congenital malformations, increase in incidence of cancers, and an increase in antimicrobial resistance. 69,000 houses completely destroyed. And so in terms of the long-term effect, the rehousing people who lived in these homes, and these 69,000 people's homes, bedrooms, kitchens, living rooms, the stress of losing the home, the economic consequences of losing the home, these will be a legacy that will need to be dealt with at the end of this war. Because you will never get the kids back into the schools until you empty the schools, and you can't empty the schools until you get people back into their homes. And so you have yourself a vicious cycle where you can't move. And then we come to the destruction of the social, and my colleagues talked about the destruction of Palestinian health systems, Palestinian academic institutions. The 2 medical schools in Gaza, at the moment, we've been working on a project trying to find placements for over 300 medical students who should have been graduating next month. So these 300 students, on a personal human level, are seeing years of hard work disappear. And on a health system level, we are losing 300 potential health professionals at the moment where the Gaza system needs them the most. And then you look at the 6 years of medical school, and the catastrophe also just increases exponentially. And part of the reason that these universities no longer exist is the fact that they were all carpet bombed, but also, and I was fortunate to spend some of the war with the ex-dean of one of the medical schools. And as early October, he was telling me, if this war was to stop today, I cannot teach anatomy or physiology in my university because both professors are dead. And so, like the destruction of the health system, where not only were the buildings destroyed, but also 345 doctors and nurses were killed in order to ensure that even if a hospital is built, it doesn't have the staff that it requires. Academics were targeted in a way to ensure that even if the buildings were rebuilt, it will take a long time for these centers of education to come back. And so when you look at the number of students, school teachers, schools that were destroyed, every aspect of that social fabric that ensures longevity and the ability to recover after a war has been dismantled. And then you look at the economics of what has happened. 2/3 of all jobs in a place that already had 70% unemployment have disappeared. You have 16,000 children who've been orphaned. And what that entails in terms of long-term mental health, long-term physical health, economic consequences. Currently, children are being sent unaccompanied from the north to the south due to the starvation in the south. 70% of people's homes have been destroyed. 85% of the population has been displaced. 200 sites of historical importance was destroyed in the first 100 days only. Also part of that social genocide that is critical for the permanence of the destruction. 16 cemeteries. And when you think about 16 cemeteries, you might think, so they're already dead, why are you so upset? But these are people's loved ones. These are people's social lineage. These are people's lives that are being dismantled so that they have no connection to the place. And is a critical component of that ethnic cleansing. So the other day, I was fortunate enough to finally have one of my favorite critical thinkers, Akil Mbembe, translate his book from French into English. And he defines the biosphere as not only a physical, organic, geological, or atmospheric reality, but also being interwoven with the nominal realities that lie at the source of existential meaning. And that existential meaning ranges from your ability to visit your parents' graves when the cemetery is destroyed, to your ability to seek medical help and to know that your kids are going to go to school and they have a university place to go to. And so the biosphere that the Palestinians find themselves living in Gaza is that ecology of war. And therefore, in order for us to think about the day after, and I know it's very difficult to think about the day after, but it's critical to think about the day after because that's why this war is being so prolonged, is that we stop thinking about the day after and we consider the end of the war as a victory, where we know the Israelis have always attempted to achieve in ceasefire what they could not achieve in wars, i.e. the strangulation of Gaza by the means of the siege. We need to imagine how we can dismantle this biosphere in every aspect, because as we could see, this biosphere creates a web of conduits of injury that reshapes people's health in a holistic way, in terms of mental health, in terms of physical health, in terms of social health. And so that's when the group in Johns Hopkins and the London School of Tropical Medicine and Hygiene tried to quantify. They were trying to quantify the permanent. And they saw that if the war would stop now, there'd only be around 11 to 12,000 excess deaths by August. But if the war were to continue, then you will have up to 80,000 excess deaths. And I think the reason why the Israelis are prolonging the war is to ensure the transition from the immediate to the permanent, and to ensure that this biosphere is sufficiently entrenched that it is capable of continuing on the work of unlivability, unsustainability that the war was aimed at producing. And we can see in Gaza what we saw in other places, but drawn out. We saw it in Syria, we saw it in Iraq, we see it everywhere. That war alters the biosphere that people live in. And that these destructive and degrading transformations are irreversible and have to be individually taken and reversed. And that these conflict-related pathologies are becoming endemic and extend beyond the immediate damage caused by the weaponry. And unless we seek them and dismantle them in the periods after war, the war doesn't end. But in the immediate, we see other troubling phenomena. First and foremost is the it's a difficult one to pronounce, the humanitarianization of genocide. So you drop the food from the sky, you invent a pier so that the genocide can continue with a humanitarian hue. You destroy every hospital with the exception of one, then you allow as many medical and surgical teams as would want to come in, so that you appear to be responding to the emergency needs, even though those who go into Gaza now tell you the surgeons sit around waiting for one of 9 operating rooms left in Gaza. So all of these teams that you hear about going in, they're really all struggling to get access to 9 operating rooms. But also, we see that insidiousness of the marriage between humanitarianism and now genocide in other aspects. You know, one of the main UN agencies is headed by someone whose life partner is a CEO of one of the weapons companies. one of the main UK NGOs CEO, was in the middle of the genocidal war, despite the position of Keir Starmer, the Labour Party member, was running to be selected as a member of Parliament in the Labour Party. And so what we can see is this kind of re-emergence of humanitarianism that can coexist with not just war, but with genocide. So you can send the bombs, but as long as you send the food, it's okay. You can send the doctors, but as long as you can destroy the hospitals, it's okay. And so what we need to do is reimagine a Palestinian healthcare that addresses this biosphere that we spoke about, but that reflects the need that we spoke about earlier and my colleagues highlighted as being the legacy of this lecture, and the difference between solidarity and charity. That what is required in Palestine is the act of solidarity and not humanitarian charity. And that solidarity means that Palestinian health workers are emboldened and enabled to remain steadfast rather than have solutions thrown at them without consultation. Solidarity means that first and foremost the causes of this war are addressed rather than mechanisms to coexist with the genocide are explored. And so we need a health system and not a medical system that takes away these conduits. And so it's critical to end on a positive note. And there's no better positive note than from the immortal Bobby Sands, who gave his life for freedom. Thank you very much.
Do you hear me? Who is, by the way, continuing his work relentlessly after having been within Gaza. He's now traveling around the world trying to, get this to stop, but also to rethink what will happen after. So we will now have two commentaries, and I'm introducing both of them so that that they can just come up or after that. Gudrun Østby is the first one. She is a research professor at the Peace Research Institute Oslo and deputy editor of the Journal of Peace Research. She has published widely on the socio-economic consequences of political violence, on conflict-related sexual and gender-based violence, on Islamist radicalization, and on developmental aid. And then after that, we will have Mats Gilbert, and I don't think he needs, everyone here knows about him. He's a Norwegian physician, humanitarian activist and politician, and professor emeritus of emergency medicine at the University of Tromsø. And he has arrived today, actually, from Boston, rescheduled his flight. Thank you, Mats. And then after these two short commentaries, we will have Sine Grude lead a panel conversation. And Sine is a medical student in our medical research school program and a member of the Per Fugelli Lectures organizing committee, an indispensable member, I must say. So please, Gudrun, thank you.
So much for the invitation. I'm really honored to be here and provide a few comments. Thank you so much for your presentation, Dr. Ghassan. It was really painful to listen to you. but still, we really need to hear this over and over and over. And listening to you reminds us that these are not purely numbers, but these are individual people's lives. I want to take a slightly broader perspective. I was asked to talk about my research on women and children in conflict with a more global perspective, so I'll do that. The sad starting point is that the world is really becoming a more violent place, which we have seen over the past years. This graph here shows the direct deaths, the number of people who die in relation to actual battle events. It's from the Uppsala University's conflict data program, and it shows a sharp decrease since the Cold War. With the exception of the Rwandan genocide. The Uppsala Conflict Data Program talks about 3 types of organized violence. We have state-based violence, where at least one side of the parties represent the government of a state. We have non-state violence, which is violence between 2 non-state actors, can be rebel groups or other organized groups. And then we have one-sided violence, which can be conducted by both governments of states and non-state groups, targeting innocent civilians. And we see that with the latest updates from the UCDP data, the number of battle-related deaths doubled from 2021 to 2022. That was largely due to deaths in Ukraine and Ethiopia. These numbers still don't include the deaths from Gaza, but we heard that there are thousands and thousands, maybe 40,000 deaths. But these are the direct deaths from conflict. And conflict has affecting people so much wider than just the conflict deaths. In order to say something about the scale or the magnitude of ordinary people affected by conflict, we need to know where they are, where conflict actually happens, and where people live. And we heard, as Espen mentioned initially, that 1/4 of the world population, according to the UN, live in situations of conflict and crisis. There are many ways of approaching how to estimate this. If we look at only the conflict-affected countries that are marked in light yellow here, actually more than half of the world population live in a conflict country. But when we look at where the conflict is going on, which is shown by the orange dots here on this map, this is where ordinary people can feel it affecting their daily lives. What we have done for Save the Children is trying to count how many children grow up or live in situations of conflict. And we have used this data from the Uppsala Conflict Data Program, which record for every conflict. They have specific events where they put coordinates, geographical coordinates about where the individual events happen, when, and they have estimates of how many people were killed in relation to those specific conflict events. We then take a radius of 50 kilometers and draw circles around all these points. And we try to count all the children living within these circles using population data from the UN. And when we do this, we find that 468 million in our last update from 2022 children were living in close proximity to violent conflict. That is 1 out of every 6 children. If you count other types of crises, if we increase the radius, of course, these numbers even rise further. But our rationale is that within 50 kilometers, if a hospital is attacked, if schools are destroyed, this is really something that is felt by the local people. Equally disturbing is the fact that not only is the actual deaths, the battle-related deaths, increasing over time, but so is the number of innocent civilians that are living in close proximity to these conflicts. This shows the graph of the children affected by armed conflict from 1990 to 2022, and we see that there's a continuous increase. What disturbs me even more is the dark red shade on the top of the graph, because this shows the number of children who not only live close to conflict events, but who live close to the extremely violent conflict events, with more than 1,000 battle deaths in a year, less than 50 kilometers from where they are living their daily lives. So the problem is increasing, and it's becoming more violent. The UN every year reports on what they refer to as 6 grave violations against children. Those are killing and maiming of children, recruitment or use of child soldiers, attacks against schools and hospitals, rape and other grave sexual violations against children, abduction, and denial of humanitarian access. Ghassan already talked about many of these violations. What we have done in relation to our work for Save the Children is to try to zoom in on a couple of these violations, more specifically the recruitment of child soldiers and rape and sexual violence against minors. Counting the exact number of child soldiers or counting the numbers of children who are raped during war is almost impossible. The UN figures, the UN reporting is extremely important, but that is likely only the top of the iceberg. But what we can do, and what we know quite a lot about, is what conflict actors have been reported to conduct such terrible, terrible attacks, deliberate attacks on children. So what we have done is trying to isolate the conflict events where we know that at least one actor was reported to either conduct sexual violence against minors or recruit child soldiers. And unfortunately, we also find that the trends increase for both these types of violations, meaning that there are an increasing number of children who live not only close to conflict, but also close to conflict where this direct targeting of children is happening. In terms of sexual violence in the world, 3% of the world's children live less than 50 kilometers away from conflict events where the soldiers are raping children. And the number is even higher if we think of sexual violence in general. And when it comes to recruitment of child soldiers, the number is almost as high as the number of children living close to conflict. 1 out of 8 of the world's children live in close proximity to where child soldier recruitment is going on. And what happens in these circumstances? This is not only a problem for the children who are actually recruited, but it's a problem for all other children, for all other families, for the whole society. This in turn can lead to parents withholding their children to go to school because they're simply too afraid to send them away from home, which in turn has these long-term permanent effects that Ghassan was talking about. Depriving children from education, it has effects not only for their own lives and life opportunities, but also for their children and for the next generation. I'm going to talk very briefly in the end about a couple of systematic studies where we have tried to isolate the effect on access to health services for women and children. This is quite a challenging endeavor because conflict overlaps with so many other sources of hardship, like poverty, for example. So isolating the effect of conflict is challenging. What we have done is combining survey data from the demographic and health surveys, where we have information about the use of maternal health services and immunization of children, for example. And these are also georeferenced, so we know what villages or which towns these women who reported the use of these services live. We can combine this with a conflict map and then compare, even down to the detail, children born from the same mother before or after a conflict event happened in their proximity. And what we find, not very surprisingly, is that proximity to conflict, of course, increases the risk of maternal deaths by some 10%, which can be then ascribed to conflict only. It also decreases the number of institutional births. Our estimates shows that in sub-Saharan Africa, almost 50,000 children every year are born outside of hospital due to conflict. That's an addition to all the children who are born outside hospitals in the first place. When it comes to access to vaccinations, we find a non-monophonic relationship. We actually find that in the high-intensity conflict situations, not surprisingly, the access to vaccinations drastically drops. And that's understandable because it's high risk, of course, involved in accessing these places. But in the low-scale conflict areas, for Africa, we actually find that the access to vaccine is higher than in the non-conflict affected areas. And this may be due to interventions and successful provision of health services in crisis. And this brings me to the last point I wanted to make, because I also wanted to end with a somewhat positive note. We have also conducted local level studies of aid to see if aid actually works. There's been a long debate about international aid over the years, and if it's any point at all, if aid is effective or not. What we do when we take the same approach as we do with conflict, and in the case of Nigeria, which is our first case study, we look at the children growing up in areas close to the presence of aid projects of any type. And we compare the likelihood that they will survive their first year of life compared to the children who do not have aid in their close proximity. And we find that aid works. But aid does not reach the people who need it the most. So it works, but we need to really focus on the people who need it the most. And I think we have heard a very good reason to speed up the efforts. It's the responsibility of all of us. Thank you.
So, Dr. Ghassan, really, I think you deserve a big applause from all of us for your bravery, really. And we've been traveling around a little bit, around in the world, so we meet in conferences and we talk and we talk and we talk. And Ghassan has something to talk about. I was in Gaza last time in June last year. I was there 3 times last year. I traveled to Gaza 2 to 4 times a year, doing research, teaching, working with my fellow doctors in Gaza, and developing healthcare systems together with them. And I go there always when there is bombing, if the occupiers will allow me in. So this time I have not been allowed in by name because my tongue is too dangerous, and they do not want to get out the sharp end results of their occupation and their bombing, documented in numbers, in pictures, in patient stories, showing what people of flesh and blood are exposed to during this type of warfare. And I'm just going to have some few comments, and my main point is that we have to act. We have to stop talking. We have to act. There is an ongoing genocide. There is an ongoing ethnic cleansing as we are speaking. Norway does far too little. The academic institutions have done almost nothing to raise political awareness. They have to get their act together and start to show where they are standing. Our Minister of Education has not said a single word. I'm very happy that the Vice Rector is applauding. That means there will be action. But first of all, shukran jazilan to... Mossad always gets into my slides. Shukran jazilan to you, Dr. Ghassan. So I want to update you on the situation. I came from Ireland 2 hours ago. I've been to the university in Galway, who has their Nelson Mandela Anti-Racist Week this week and have a massive program on Gaza. We were in Turkey a few weeks ago, the university in Istanbul, a massive 3-day seminar on the situation in Gaza from political point of view, medical point of view, sociological, historical, cultural, everything. And I haven't seen any Norwegian university who have put aside their books and said, we're living in this world now. And we have to act now to get more knowledge, to get more active, to get more understanding of what is the situation in occupied Palestine. And this is extremely pressing. And as I will show you, we can keep a distance to this, but it is very, very concrete. It's very close to us, and of course it's very close to those of us who know it. This is the note I got yesterday from 2 days ago from the Minister of Health, Dr. Youssef Abarish, the latest statistics. And you can see that during the last 24 hours, the Israeli occupation army has killed 93 Palestinians and injured 142 in 24 hours. Since the first verdict in the International Court of Justice, which said we will open an investigation to see if there is a genocide ongoing, they said two things. They said Israel has to stop immediately the attacks and killing of civilians, and they said they have immediately to make accessible humanitarian support, food aid, immediately. They have done nothing of the two things. The fence is still closed. The hundreds and hundreds of trucks are standing at Rafah, not getting in. People are starving to death. 27 children have so far starved to death, according to the UN. And they keep bombing, and they keep killing between 90 and 120 Palestinians per 24 hours, civilians. So where is the Norwegian government in supporting the South African case? Where is the Minister of Health saying clearly that Norway do not accept attacks on healthcare institutions and healthcare workers? And where is the Prime Minister saying enough is enough, we will impose sanctions on Israel as we did on Ukraine? I think Norway is remarkably soft-spoken and remarkably, almost shockingly passive in commenting on what is going on in Gaza. And I hope there will not go another 75 years before there is another author who will uncover what Norway did not do during a genocide. Because the silence now is almost overwhelming as far as I can see, and that's the point with my lecture. So let me take you to what is going on right now. A massive attack on the flagship hospital in Gaza, the Shifa Hospital in Gaza City. It was attacked, as we all know, and invaded previously. Then the Palestinian healthcare workers, under the leadership of Dr. Youssef Abarish, have gradually rebuilt function. They have opened and started function, day surgery, dialysis, and other functions. And the night to the 20th, they attacked again, and it looked like this. This is from the proximity of the hospital, just outside. There is no sound here. No sound? Okay. I'm sorry, you should have heard the sound. What you see here is the bombing of the neighborhood. And what you see to the right is a father and her daughter who has been taken care of by their neighbors and are being attempted to be resuscitated on the floor in the emergency room of Shifa Hospital. I wish you could hear the sound. It is extremely painful to see this massive loss of lives that are man-made, premeditated, planned, and intentional. The attacks on the Palestinian civilian population is intentional. They are not enjoying any of the international rights of protection from the UN declarations and all Geneva Conventions, and they are killed by the thousands and thousands, as Dr. Ghassan mentioned. I got this message yesterday morning from Dr. Ghassan Abu-Sittah. He's a senior surgeon, very experienced. We both know him, we've both been working with him, and he is one of the leaders who has been trying to build up again Shifa function. And you can see what he tells us, that on March 19, the Israelis again invaded Shifa. Colleagues who have been permitted to leave the hospital reported that the soldiers break into most of the hospital buildings. He mentioned that they undressed the male medical staff and left them for hours in the cold weather. They scanned their faces with a camera and took them one by one for humiliating investigations. Many were arrested and were taken to unknown places. Some were forced to leave the hospital and displaced to the south of Gaza, half naked, and others were ordered to go back to the hospital. For now, I do not have any information about the patients in the hospital. Soldiers assaulted and violated our medical staff and workers, and they denied them food and water. And in addition to that, I got this one a few hours later. These are the names of the doctors who have been abducted by the Israeli occupation army. And one of our colleagues, Dr. Wazim Mohani, was shot through the chest when he followed the orders from the army and left the hospital to go south. He was operated at El Ahli Arab later yesterday and is in critical condition. So these are humans, these are doctors, these are nurses, these are humans like us who try to save their people in the healthcare system. And it's all known. It's all known. Those of you who are interested can subscribe to this one. This is the OCHA Daily Flash Report. Comes every second day in my inbox. It's from the UN OCHA, and it has this one page, A4 page, with all the detailed numbers. This goes to all foreign ministries in the world. The Norwegian Minister of Foreign Affairs, Minister of Health, they all have access to this. And it's extremely detailed. It's, of course, quality controlled numbers. And let's just blow up one part. This is the part from 2 days ago. Day 164, and you can see the numbers, and you can see the inclination of the curve from day to day, from the 7th of October, of killed. These are the killed ones. They are not died. They have been killed, and you can see it's a cumulative curve, and these are the numbers of injured. Parallel with this massive increase in number of injured, up to 74,000, has been a systematic attack and reduction of the capacity of the healthcare system. Only less than 20% of the primary healthcare system is working, and it's only about 12, maybe now 8 of the hospitals, which started with being 36 hospitals. It's only 10 that are working now. Both Nasser Hospital, which is the largest in the south, and Shifa is now completely out of function. This is what Dr. Abu-Sittah told me today. So the data, the documentation, the evidence is overwhelming. This is the report that came from the Global Nutrition Cluster on the 19th of February, also not commented on by any Norwegian officials, nobody from the government, nobody from the Norwegian Institute of Public Health. This is such a horrifying report, and they conclude that they have never ever seen, it has never been documented such a rapid decline in nutritional status of children and women in history. So actually this man-made starvation that is imposed on Gaza, don't forget that Gaza has been under siege before this attack for 16 years. And there is a massive literature on anemia, on stunting, on low birth weights, and so on, because of a very poor food basket in Gaza. 90% of the water in Gaza is unfit for human consumption. We know that from before. So this, what is happening now from the 7th of October, comes on top on a population who were already on their knees from a long-lasting, very harsh siege from the Israeli government, with support from the US government, and with muted support from the Norwegian government. I'm not going to say they support it, but they do not actively resist it. This is Dr. Abu-Sittah. Young, extremely gifted doctor. He's a pediatrician, he's married, he has 5 children. He's been the leader of the healthcare system in Gaza for 10 years. He's a very staunch leader. I spent the time in the taxi from Gardermoen and here talking to him to get updates. He's the one who said 3 months ago that we are now not losing the majority of civilians in Gaza from the bombing. We are losing them from the triangle of death. That has 3 poles: starvation, man-made, deliberately; lack of water, man-made, deliberately, with dehydration; and diseases. And in a population of 2.2 million people, you don't have to be a medical doctor to know that there is cancer, there is malignancy, cancer, there is psychiatry, there is diabetes, there are all sorts of diseases that need treatment. So in addition to these 3 elements, starvation, dehydration, and disease, I would like to add hypothermia, because the clothing of the people in Gaza is very poor because of the poverty, rampant poverty because of the siege. And many of the kids will get wet, and the wind from the Mediterranean come in. It's winter now, and when you get hypothermic, your immune system is reduced, and you're more sensitive and vulnerable to, for example, infectious diseases. So this is a very destructive, very negative downward circle, these elements. And for the diseases, as I said, multiple diseases, non-communicable diseases, cardiovascular disease, I mentioned cancer, diabetes, very high prevalence of diabetes in Gaza because of the bad nutritional situation. So 15.3% have diabetes 1, and insulin is not available. has not been for 5 months. So you can only imagine the magnitude of these man-made health problems that the world is sitting idle by and accepting that happens day by day. And then more attacks on healthcare, as we have seen, the attacks the last 2 days on Shifa, means, practically speaking, that the people in the north of Gaza, around 400,000 now, do not have access to the capacity of that healthcare system that Shifa would offer. Yes, just be quiet, I'm soon finished. And I'd like to quote, I don't have to use my words, but I'd like to quote Edward Said, you know, the famous thinker, Palestinian. He says in 2003, "In fact, I cannot think of any other country on earth that in full view of nightly television audiences has performed such miracles of detailed sadism against an entire society and gotten away with it." And they still get away with it, Israel. And there is more sadism. They take out, for example, from the supplies, they take out anesthetics, they take out all needed surgical equipment because they call it dual use. So a lot of the supplies that are standing at Rafah contains exactly what the healthcare system in Gaza needs, but it's not allowed in by the occupiers. Why? You can't really make a rocket with a vial of anesthetics, can you? But still, they are denied access to the most important things. So to finish up, just to mention the systematics of the attacks on Palestinian healthcare. This is the WHO report that comes every year, Right to Health. This is the one from OPT, Occupied Palestinian Territory. And it sums up very, sort of precisely that from 2019 to 2021, there were 563 Israeli attacks on Palestinian healthcare in Gaza and the West Bank. It's all known for us who work in the Palestinian healthcare. This has been known as a tactique, as a modus operandi from the Israeli army since 1980. They go into hospitals, they bomb ambulances, they kill healthcare workers, and they kill patients. This is the latest data sheet from WHO. This is the number of attacks on healthcare in Gaza from the 7th of October until the 12th of February, 378 attacks. And there hasn't been a word from my Minister of Health, from the labor-controlled Norwegian health ministry, to use the same phrases as they use about the Minister of Health in Gaza. They always say, from the Hamas-controlled Minister of Health. So you see, it's a systematic pattern of attacks, violation of all international laws, of course, because healthcare is protected, and so are healthcare workers. Let me wrap it up by just pointing to the number of healthcare workers that the Israeli occupation army has killed in Gaza so far. The number is 348 of Ghassan Abu-Sittah's colleagues, of my friends, of young medical students, of very dedicated people who have sacrificed actually their lives to be at hand for the population when they are needed. So this is well known. This is from the same fact sheet. Just to pay tribute to our colleagues, behind these numbers, there are humans, and I'll just share with you 2 stories. Maysara Al-Rayes. He was my medical student in Al-Azhar University. I teach there. I've been teaching there for many years. He was a leader. He was the head of the Gaza IFMSA, International Federation of Medical Students Associations, and he was an organizer. We started a very interesting project called You Can Save a Life, where I trained medical students to be trainers, and they went out in the community, in the best legacy of Per Fugelli, and trained lay people to save lives. Open airway, do CPR, stop bleeding, comfort and encouragement, and keep warm. So this is Maysara, this is Anas, who is his best friend and also a partner in the project. Maysara was extremely polite, extremely hardworking. We just got a load of mannequins from Lærdal for the project. He was a brilliant leader, very punctual, and as almost all Palestinians I know, very polite and cultivated. And he got a scholarship to England, did his master's, and came back because he wanted to specialize as a pediatrician. We also did research together. Part of the project was, of course, to teach them research, and we were extremely proud when we could publish in The Lancet. So we do this research. No, we do not do research anymore, Maysara and I. We did it. because my son Al-Reyes, who lived in the middle of Gaza City, he stayed in a house with his mother and his father, his two sisters. One of the sisters had 3 kids. And one evening, actually the 6th of November, he came home, went to bed. His 2 brothers were out looking for bread, and the Israeli came with the Air Force and bombed the house with all the people inside. And my Sarah was killed with his parents and his 2 sisters and his 3 small onkelunger in the house. So I wrote this commemoration of him. He is now gone, and so is his whole family. We called each other in Geneva, in Gaza, and we cried a lot, of course. And the next morning, I got this message in my WhatsApp from Anas, his best friend, who is working in Geneva in WHO. He said they just killed his 2 brothers who were trying to get bodies from under the rubble. So the next morning, when daylight came, the brothers tried with their hands to dig up their family members. Maybe they thought some could be alive. At least they wanted to give them a burial. The Israelis come back, and this is again a little short video showing the neighbors and some rescue people coming to the house to find the helper and the 2 brothers killed. They are lying there. So now the whole family of Al-Reyes is killed. Mohammed and Moayed, who tried to find their fellow family members. And they are 2, 4, 6, 8, 10,000, 20,000 of the people who have been willfully killed by the Israeli occupation army and are still getting killed. Dr. Samera and Dr. Hani married. She was a pediatrician, married to Hani, Dr. Hani, who was the head of the emergency room in Shifa. I knew him well. They were killed in their house while sleeping, 2 young doctors with their 5 children, Shireen, Tia, Samir, Wafa, and Sarah. And this is Dr. Hani, a very, very friendly, very humorous, and extremely dedicated emergency physician. So, my friends, we cannot be idle. We have to act. We have to do more than talk. I suggest that all the universities in Norway make a common political protest to the Minister of Education and the Minister, the Prime Minister in Israel, and demand that educational institutions are protected. All the universities, not some, all the universities in Gaza are flat bombed. There are no more universities, no more open schools. There are 800,000 pupils who have no access to education. And we have to do more. Why don't the universities flag the Palestinian flag? Fly the Palestinian flag. You're flying the Ukrainian flag. What is this? What is this difference between all the activities, support, sanctions, funding, and everything with Ukraine? Now, that's fine, I support that. But where is the comparative engagement for Palestine? Why is there no Palestinian flags in the University of Oslo? Why is there no formal academic protest against the researchers and the academic leaders in Gaza getting killed? So, my friends, solidarity is not an act of charity. It's an act of unity between people fighting on different terrains towards the same objective. When we fight for good education here, we support our brothers and sisters in Gaza. When they fight for dignity and human rights in Gaza, they fight for our human rights. If Israel gets away with this attack, with their usual impunity, it signals a very dark future for all of us, because this is not an attack on the Palestinians. This is not Hamas against Israel. This is the Palestinian people exercising their right to resist occupation and fight for freedom, just like we did in 40-45 with arms within the limits of the Geneva Convention. So what is Norway doing? Next to nothing. What are the universities doing? Next to nothing. The students are the most active parts. I hope and I really pledge that the university leaderships can know their role in this historical situation, act now, do more, be more outspoken, and join forces with other universities in Europe who are actually active. So in Arabic, the 2 last words, it's shukran, thank you, and it is sumud, which means steadfastness, which is the virtue of the Palestinian people. They are fighting a national struggle against an immense enemy who shies away from nothing in attacking and killing the civilian society in Gaza. So To end with Nelson Mandela, he said that no power on earth can stop an oppressed people determined to win their freedom. I subscribe to that, and I wish we can all support the Palestinian people on their hard struggle on the way to freedom. Shukran jazilan, and shukran jazilan to Dr. Ghassan. Habibi.
Okay, there we go. Thank you, Ghassan, thank you, Gudrun, and thank you, Mats. This is, of course, a topic that we could talk about for hours and hours. And we are now going to go into our panel conversation, where we already have our panel lined up here. And I originally had talked about introducing this topic of humanitarianism, but I think Ghassan, at the end of his lecture, did a brilliant job of explaining why this is important to discuss right now, because it is something that is very relevant to the way that we approach what is happening in Gaza right now. And I also want to lift the discussion a little bit on talking about humanitarianism more broadly. You all probably already know Wasim Sahid, cardiologist and Norwegian public figure who has been very engaged in the media debate in Norway on how we cover what is happening in Gaza right now, and he's also been engaged on Palestinian rights since his youth. Then we have Amanda Hulland Spjeldnes, who is a medical student here at the University of Oslo and a research student who's been working on conducting research in Lebanon in Palestinian refugee camps on AMR, as Ghassan mentioned as well. And she's also the head of Norwegian People's Aid Solidarity Youth, and has published a podcast which has talked quite extensively about humanitarianism as well. Then we're very pleased to have Jihad Amar Al-Mahdi, who is a master's student in economics here at the University of Oslo. And he's also representing students for Palestine here today. And Jihad's engagement with this cause runs deeply personal, as he spent half of his life in Palestine and also has members of family and friends still in Palestine today. And then lastly, we have Usva Malek, who is head of international affairs at the Norwegian Medical Students Association, and has been very engaged, both nationally and internationally, international affairs in IFMSA, the International Federation of Medical Students Association, and has conducted research on in Lebanon as well, on Palestinian refugees there. So please welcome them properly. And I think with every new conflict or crisis, there's a change to the way that we view humanitarianism, and there is a great need to really learn from how we think about these things, because every new conflict and crisis teaches. And I think what's been happening in Gaza has taught us things maybe we haven't taken the lessons, but for a very, very long time. And so we're going to dive into both what's happening now, but also in the past in terms of humanitarianism in Gaza, and towards the future. And I want to start by asking you, Ghassan, because I read in an interview recently that you talked about James Baldwin, and you called him a great humanitarian thinker, and then you sort of corrected yourself to talk about him as a humanist thinker. And what does a humanitarian or a humanist really mean to you, and what comes into your mind when you talk about these things?
For me, the issue and the kind of what we now recognize, unfortunately, as a humanitarian industry, which kind of started in this early 70s, and unfortunately came as a replacement to, or as a evolution, depending on where you stand, to solidarity groups. That humanitarianism has been hijacked by Western governments as a process of whitewashing foreign policy. And therefore, as long as you... So, I mean, for me, I kind of explain humanitarianism with the following figure. Britain is the biggest funder of humanitarian organizations working in Yemen, to something like 2 billion. But Britain made 11 billion selling weapons to the Saudis during the Yemen war. And so for me, the humanitarianism and the humanitarian industry, as we have known it since the mid-70s, really has become a whitewash. And we see it now in Gaza, the American administration's fixation with dropping food and sending it from the sea, when we all know that actually just lifting the siege means that in 5 minutes these 2,000 trucks can be inside Gaza. And more importantly, that if they stop sending the bombs, the war would stop within days. And the fact that these two processes can coexist is what now lies at the heart of the crisis of humanitarianism.
Amanda, you've recently published this podcast on humanitarianism, among other things. What are your thoughts when you hear Ghassan speak about these?
Yeah, I think I have a pretty critical approach to humanitarianism, and the way I see, or it's difficult to define humanitarianism, but I think of it as a Western ideology that lays out the fundament for how NGOs work in the global South. And I also think that, you know, the humanitarian apparatus, it pushes Western values. And what we've seen recently in Gaza is that it kind of shows us very clearly that humanitarianism, it is not neutral, and it is not universal values that everyone believes in, but it is very political. And for example, is saving lives, which is a humanitarian value, it's not, you know, prioritized by Israel, and it's not universal value that everyone shares. And I also think that humanitarianism and NGOs, in a large extent, their work, they empower the Western countries more than they empower the local people. And I think this is a very important topic for the future of Gaza as well, which we will probably get back to in how we can empower Palestinians.
Wasim, there is often this idea of doctors being sort of the face of humanitarian efforts, or there's medical aid in many of these humanitarian efforts. What are your thoughts on this as a doctor?
Well, I mean, certainly doctors play a role, but everybody who's ever worked in a hospital or at a clinic or within the healthcare system knows that it's a team effort. There are so many levels. I mean, you have so many healthcare workers, nurses, doctors, technicians. Doctors alone cannot do anything in a modern healthcare system. So it is a team effort. And that was something that I was so touched by with Ghassan's talk, that the way the war is destroying the health system in Gaza at such a fundamental level. And I'm so disheartened. Of course, you can hope and pray for the bombings to stop and for people not being killed, but the mountain of work that lies ahead for the health system, which has been totally broken, and with so many injured people and so many sick people, so many mentally traumatized people, how on earth are they going to get back? It's going to take decades, in my opinion, even if it was total peace. So, yeah, doctors play a role, but it's the destruction of a whole system that's so concerning now.
We don't have as much time as we planned, but I want to talk a little bit about the humanitarian situation in Gaza prior to October 7th, because I do believe there is a before and after as well. And maybe, Jihad, you can talk about, because the humanitarian presence in Gaza has been extensive for many decades, and UNRWA, among others, have in many ways been a lifeline to a lot of Palestinians. And in what ways do you think we can think about the role humanitarian actors played in Gaza prior to October 7th?
They play a really important role in keeping a lot of parts of the civilian society in Gaza working. And this is why Israel specifically targets UNRWA now, because UNRWA has been at the center of keeping Gaza running. Getting rid of UNRWA achieves this man-made starvation, this man-made catastrophe in Gaza. Getting rid of these NGOs helps them get to that goal. Even though we have had these organizations there, I think countries should play a bigger role. And we have seen that prior to the 7th of October. Gaza has been reported to be uninhabitable by the UN by 2020. That's how bad the situation was before the war.
Yeah.
Now it's even worse. And this is why NGOs play an important role, but we need to involve bigger neighboring countries like Egypt, for example. These countries do not play as a big of a role as they should.
Isva, I know that you've been conducting your research in Lebanon in Palestinian refugee camps. What are your thoughts on sort of the deliverance of humanitarian aid before 7th of October?
So there is, like Amanda just touched on, the principles in which humanitarian aid was delivered was based on Western ideologies and not so much the needs of the people. So me specifically, my project was on mental health. This is, again, one of the topics about like how humanitarian aid is so political, is because we realize in the recent years that mental health has become a very popular topic, a topic a lot of people want to research about. There's a lot of policy making about mental health on a state basis. So we know that these are projects that will be able to get funding from the states and from other organizations as well. So they look very good on the paper, and there are proper policies, but there are no proper practices that actually practice what the people need.
Ghassan, I think you touched on in your lecture on sort of how you talked about how we don't need a medical system, we need a health system, and we need to build a state in Palestine. How do you think about creating sort of dependency on humanitarian actors when they've been in Gaza for so long?
So, I mean, if we look at the siege, the 16 years prior to this war, we see a process of titration. Israel literally titrated life and death in Gaza. We know the story that the Guardian published showing the calorie count that the COGAT, the military body responsible for managing the siege, used to do to calculate how much food would come into Gaza. And so this titration process in which people's lives would lie somewhere between an incomplete death and an incomplete life. And the humanitarian sector then became sucked into this titration process. And so the Israelis would titrate how much aid would be allowed in. And after each assault on Gaza, 2009, 2012, 2014, 2021, which the Israelis would call mowing the lawn, the humanitarianism would be used to bring back kind of into that level, but never to solve the problems that existed in Gaza. And so what had happened is two things. The humanitarian sector became sucked into that titration process, which prolongs the siege, and humanitarian actors and aid then became a process by which you subsidize the occupation. And so Israeli ports controlled the aid that would come in. Israeli taxes would be levied against the aid that would come in. And Israeli policies aid would ensure that Israeli policies would continue so long as they did not create a humanitarian catastrophe that then becomes politically problematic.
It's sort of creating a structural poverty, and that sort of sets the scene for a humanitarian crisis in the past, but also especially now that has been much worsened by the war. Jihad, what do you think has changed now in terms of the humanitarian sector in Gaza after October 7th?
Well, we see that most of the civil society does not exist anymore. Police bodies don't exist. The health sector, as doctor said, does not really exist anymore. So with those sectors not existing and a lot of the humanitarian organizations not allowed to work in Gaza and talk of dismantling UNRWA by Israel, it's pushing towards worsening the situation, really. As doctor said, with all the injured people and the starvation that is happening in Gaza, the death toll is going to only continue to rise up. If we don't put pressure on Israel to stop its campaign against Gaza, this will only get worse.
Wasim, what are your thoughts? We're sitting in the safety of Norway right now, and there are a lot of students and people and organizations that are engaged. What is our role? What is our role as individuals and as Norwegian organizations now?
Well, I think our role is to raise our voices, to show solidarity, to stand up against state-sponsored terrorism, which Israel does. It is to protest against apartheid. It is to protest against daily killing of men, women, children. It is to protest against starvation of children and people living in Gaza. I totally agree with Dr. Mats Gilbert. We are far too quiet. I have tried using my platforms to raise my voice. I know it comes at a certain expense. One thing that kind of mystifies me a little is that it's so quiet from the academics. It's so even the politicians are not saying so much. Other colleagues, other healthcare workers are not really saying that much, but they will come to you privately. They will come to me privately every day and tell me it's so good what you're doing. We support you. What Israel is doing is so wrong, but they will not say it publicly. And I don't understand that. I mean, what are people here so afraid of? Why is it so dangerous for them to say that genocide is not right? Why is it so dangerous to say that it's always wrong to kill children? So that is what we have to do, because for me, humanism is standing up for your fellow humans. It's raising your voice for those who are not able to raise their voices. It's standing up against injustice. And in this conflict, it is very easy. It's standing up against apartheid, and it's standing up against state-sponsored terrorism. That's what we have to do.
The three of you representing or members of organizations, what are your thoughts to what Wasim is saying here?
If I can start, I definitely agree. And I think, the slogan for my organization is solidarity, not charity, as you also talked about, Dr. Ghassan. And but I represent myself here and not my organization mostly. But in Norwegian People's Day Solidarity Youth, we work with pushing politicians, push for political change, for justice for the Palestinians. And I definitely think that I visited the West Bank on a medical internship last summer at Rafidi Hospital, 2 summers ago in Nablus. And there were a lot of posters on different MRI machines and X-ray machines, like this is a gift from the government of Norway or the government of Japan and things like this. And the medical students repeatedly said, well, we don't really need more money, we need your solidarity and we need your political acts. So I think I definitely agree with what you're saying. We should go to the streets and push the politicians to make the political changes for the Palestinian people.
One of the maybe Jihad or Usva, do you want to add anything to what
I totally agree that we've been far too quiet, especially with the role that Norway plays in the conflict right now, especially with the weapon production. Even though we try to pretend that we're a peaceful nation, we are one of the only producer of the M72 rockets that Israel uses in Gaza right now. Our oil fund is investing in companies that directly or indirectly funds the Israeli occupation. Our government uses companies to build infrastructure in Norway that are helping build infrastructure for the Israeli settlements in the West Bank. These are things that we should be pushing on. Another thing, as us as students, we should be pushing way more on academic boycott of Israel. It should be like it should be said by itself that we should not be working with institutions that are actively helping keep up this campaign in Gaza, or work with helping keep up the education system in West Bank settlements. This is why I totally agree with you that we should be pushing more on our government and our institutions to boycott Israel and de-invest from Israeli companies and institutions that are helping keep up this campaign and occupation of Palestine.
I want to go even more into sort of the humanitarianism that is happening right now, because I think, and very strikingly so, that you said, Ghassan, in the lecture, that right now there is a re-emergence of humanitarianism coexisting with war, and how we might sit back as individuals and as members of organizations and say, hey, we did something. Our country is doing something. So then we're sort of okay with still watching what is happening. How can we think about that in the situation that we're in right now?
I think if we think about it in terms of the public health principles of preventative interventions, at the end of the day, any intervention that does not end the war, which is the cause of ill health, from a purely public health point of view, is then just either palliative or symptomatic management. Just to kind of circle back, one of the most important things and one of the things to take forward in all activism is, after the International Court of Justice ruling saying that this is plausibly a genocidal war, all acts that contribute to that genocidal war are then considered under international law complicit, and will eventually, if not now, because there's no statute of limitations on the Convention of Genocide, will be liable to being prosecuted for complicity in genocide in the future, and that includes universities. Universities that have shares in weapons manufacturers that have supplied weapons to this war, companies that have contributed in any way to this war, politicians who have made any kind of genocidal support, because we know from the Convention of Genocide that it's one of those conventions where intent is also a crime. I think there's been a serious failure in taking advantage of the ICJ ruling in pursuing activism within countries where complicity is happening. Israel is only the tip of the genocidal iceberg. The European Union, NATO, the United States is the rest of the genocidal iceberg. You don't have to pull the trigger to be the only person responsible for the genocide. The person who's given you the gun is also responsible for the genocide. The person who's continued to give you the ammunition of the gun, even after the International Court of Justice said that this is a genocidal war, is part of the genocidal endeavor. And so we need to see the genocidal iceberg for what it is. And then we need to see institutions that are part of an apparatus of 75 years of enablement and impunity that allowed the Israelis to reach a point where they not only engage in genocide, but verbally talk openly about their genocidal intent, because they feel such impunity that they are happy to talk about their genocidal intentions. And so the system of genocidal enablement that censors and works in different ways in different institutions needs to be dismantled.
Amanda, you had a comment?
No, sorry.
No, not anymore. Okay, we are running out of time, so I want to go into some of the questions that I find the most difficult to even think about, and you also touched on that in your lecture, Ghassan, and it's imagining a future Gaza Strip, imagining a future for all the people that are so vastly affected by the war right now, and imagining sort of the consequences that will keep on going for decades to come. Maybe I will just say this as an open question. You can all contribute. How should we imagine a future humanitarianism in that? How do we contribute and how do we think about a future? Basim was first. Yeah.
I think it's very simple. And we can sit here and talk about, humanitarianism and help and all that stuff, but the basic problem is the illegal occupation. So what has to change if we want to think of a future Gaza? What has to change is a change in the Western or European colonialistic thinking that, for so many decades, Western people have thought that it's just okay for them to go out and, do whatever they want to do with other countries and other people's land. So that has to change. Occupation has to end. Israel has to give back what it has taken illegally. Palestine has to be a free and independent country. That is the only real future for Palestine and Gaza.
Amanda?
Yes, I agree with what you're saying, and I think that one of the few things that give me hope in this situation is the resilience of the Palestinian people and how they will continue to fight for their country. And I think that we need to empower Palestinians in the future in rebuilding Gaza. And I think that I don't know if we should think that humanitarianism in Gaza is the right solution. We should think that empowering local Palestinians and creating a sustainable Palestinian society is the solution. And that means that we in Norway, we don't have the answer to how to do that. The Palestinians have the answer, and we need to stand in solidarity with the Palestinians in how they want to create their future. And I think that will be a challenge for the whole business of humanitarian organizations, because that might not be in their best interest, but I think that is the right thing to do, and it is what the Palestinians deserve, and it will also be the most sustainable solution for Palestinians in the future.
Usva?
And I also think, building on what you guys just said, I also think that, rebuilding Gaza is a responsibility that we all have upon us. And the very important thing is actually seeing through the playbook of humanitarianism. We have, for example, since the beginning of the establishment of Israel, humanitarianism and humanitarian aid to Palestine has existed. United States, United Kingdom, and European countries are among the traditional donors historically of UNRWA. United States being the largest one, $343 million in 2022. Germany following after with $116 million, $173 million the year before in 2021. But then you see that in comparison to the billions of dollars of funding that they provide towards military aid to Israel, and you would see, when you would see like these millions of dollars sum that is going to UNRWA, you would think that, their policies and their, must reflect an end goal to end the suffering of the Palestinians. But their policies does not reflect this. Their actions in the United States and United Nations does not reflect that. So absolutely seeing through this playbook and realizing that humanitarianism and humanitarian aid is just a band-aid that you put after actually causing the harm is really important.
Jihad?
I think a lot of what has been said already is really good, but there needs to come a point where we understand that the burden of the destruction that Israel brings upon the Palestinians in Gaza or the West Bank needs to be paid by the Israelis. Every war, I remember after the 2014 war, the entire world gathers up and funds the rebuilding of Gaza, and Israel gets an out-of-jail card from the destruction, the terror that brought upon Gaza. There needs to be a point where we stop and think, Do we keep rebuilding, or do we put a stop to Israel's occupation of Palestine and give them the consequences of the genocide that they're committing in Gaza right now?
I'll give Ghassan a comment here as well, and then we'll open up the floor. I know that we're a little bit past time, and I'm sorry about that, but there's so many things to touch on here. Ghassan, do you have any comment to
I
this?
think for me, I echo what Reverend Munzir in Bethlehem said in his Christmas sermon, that Gaza will be okay. It's a heavy price that we have paid. We've lost loved ones, and we have paid dearly. It's the rest of the world that will not recover. The fact that they have stood by and watched genocide yet again unfold, some of whom complicit in their silence, others actively complicit in this genocide. And the world will have to pay the price, because the next war, wherever it is, always starts where the last war ended. And where this war is ended is in the fact that it's acceptable to kill 14,000 children. It's acceptable to destroy a health system. It's acceptable to manufacture rapidly starvation in a population as a weapon of war. And that is where, unless there is justice, the next war is going to happen.
Do we have any questions or comments from the audience? There is a microphone that is going to go around. Mohammed up there has a question. We'll leave time for maybe one more question after Mohammed, and then we'll close off. So if you have a pressing, you can raise your hand as well. We have one more question here. Okay, so that will be it for now. Mohammed.
I mean, great debate, guys. And great presentations, by the way. My question is to Dr. Ghassan. I find the whole discussion is very abstract. We have all of those ideas that we need to do this and that, and then we need to stop helping and then try to assess as much as possible. What I'm missing right now is that we have an ongoing genocide right now in Palestine. And in your opinion, what would it take to rebuild the Palestinian health system and stop the genocide that's happening right here, right now, right in Palestine right now? Thank you.
First and foremost, the genocide needs to stop. There is no health system. I mean, that's the whole argument, is that what we're seeing is an argument being made that humanitarianism can coexist with genocide at the same time and make genocide politically acceptable and palatable. And so the genocide needs to end before anything happens. But at the same time, my point is, for talking about this issue, is that the Israelis will always try to achieve what they couldn't achieve in the war during the ceasefire, which is to continue making Gaza uninhabitable. And therefore part of the resistance of the genocidal project, and the genocidal project is in two halves. One is the war, the second is the ceasefire. The resistance to the genocidal project is what we were talking about, is to rebuild, is to make Gaza habitable, is to help people steadfast in their homes.
Please keep your question short, and then we will have a very short comment from Davina after.
My question is... Can you hear me? Yeah. My question is to Dr. Ghassan. Can you talk more about the mental health of the doctors in Gaza?
I mean, I think one of the things that I always used to think about when I was there is how fortunate I was, that at least I was sure that my kids were safe and they were somewhere else. My colleagues did what they did while worrying about their loved ones, and many of them ended up losing their loved ones while we were at work, and some of them would see them in the emergency department brought in dead. All of them lost their homes. Yet they were amazing in that they continued to come into work. Even when we lost colleagues, and we'd lost our colleague and friend Midhat Saydam, who was killed while we were, on the same day that we had been working together. And whenever a hospital would be destroyed, they would just move on and work in the next hospital, and then move on and work in the next hospital. they're physically exhausted and they're mentally exhausted, yet they are still there. And they're still there in the north. My friend, Dr. Muhammad Abeid, who's an orthopedic surgeon, he moved with me from Al-Awda in Jabalia to Shifa. When Shifa was surrounded, he stayed with his patients until Shifa was evacuated. He then moved back to Al-Awda in the north when the north was being attacked by the Israeli tanks. He was shot by an Israeli sniper who surrounded the hospital. Luckily, the injury was in the soft tissue and had not penetrated the abdomen. And a week after he was shot, he recovered enough to continue working. And all of them, you know, you kind of hear about doctors that you started with in the north ending up in hospitals in the south, but still working. They just move from one hospital to the other. And so despite the pain, what medical students need to take from this experience, watching these people perform these acts of great dedication, what they're performing are era-defining acts of commitment to the ethos of medical service that the world has never seen before.
Davina, one very, very short comment.
Sorry. Thank you, Dr. Ghassan, for this vital talk. And thank you for many of you on the panel who've spoken up in this largely silent Norwegian academia that we are working in today. I just wanted to further some of the things that Jihad mentioned about Norwegian complicity, and not just the complicity in the silence of many of our state institutions and government, but also the fact that the oil fund has $13 billion of investment in illegal Israeli settlements, that it's also invested in Israeli military or in military weapons companies that are supplying the occupation and the genocide, and also weapons produced by Norwegian companies are being used against Palestinians. So we are profiting and abetting the occupation and ongoing genocide. And I just really want to, I don't think it's enough to protest. I don't think it's enough to speak up. What can we really do that materially can not just stop the genocide, but as you've said yourself, Dr. Ghassan, stop the ongoing siege, because it doesn't end at the end of the genocide. That's just one part of the process. The genocide is a part of a process. So what can we do as academics, as medical students, as health workers to stop this, that we are actively complicit in being part of Norwegian society?
I mean, I think the ICJ has been a fundamental weapon in the hands. I think we need to legally go after these institutions for complicity in genocide. Now that that legal argument can be made, then these institutions should be taken to court. We also need to, there is a fundamental question that goes beyond Palestine, and it's a question that is being asked in the UK and should be asked in Norway. Does complicity in genocide on a moral level put someone beyond what is an acceptable limit of morality to be unseated in an election? Even if you do not believe that foreign affairs play an important role in your decision to choose your elected representatives, certainly in that decision, moral positions with regards to complicity of genocide should be used as a compass by which elected officials are held to determine whether they are worthy of being selected to office. And I think deselecting individual politicians because of their complicity in genocide is part of that. Lawfare is part of that struggle. Every available democratic tool needs to be taken, because it's a system that needs to be dismantled one at a time.
Thank you, Ghassan, and I think we will draw, no, I'm sorry, Jihad, we will draw the line there. I have the privilege of thanking you all for coming and listening. Thank you to Ghassan for a lecture that I think will sit with us for a long time, and I think has brought up questions that we will think about in the weeks to come, and hopefully elicit some action in all of us. Thank you to Gudrun for your commentary, and for Mats for his commentary, and for our brilliant panel. Yes, and thank you all for coming.